Good morning. I'm Dr. Chrissy Koth, Associate Dean of Faculty Affairs. On behalf of the leadership, faculty, and staff at Kent State University College of Nursing, I would like to congratulate you on being admitted to the Professional Nursing Sequence and welcome you to our Summer 2024 ABSN White Coat Ceremony. The nursing profession has a long, rich history steeped in tradition. Today we are celebrating the White Coat Ceremony. While it is not new to the medical professions, it is relatively new to nursing. As you continue on your educational path, you are also beginning your process of becoming a nurse as you prepare to begin your clinical experiences. This is the day that your life begins to change. This is the day that you commit to growing into the professional nurse you aspire to be for the rest of your career. There are many rights and privileges associated with being a member of the nursing profession, but there is also great responsibility. Today you will take a pledge to uphold the tenets of the nursing profession through IE cares: integrity, excellence, compassion, collaboration, altruism, respect, resilience, empathy, and service. Take a moment and look around the room at the leadership and faculty who have assembled to witness this moment in your educational journey. We are all here to teach and support you, celebrate your wins, and assist you when you face challenges. I wish you the best, and I cannot wait to see all that you will contribute to the profession. Please welcome our very own Kent State University College of Nursing Dean Dr. Versi Johnson Mallard, who will guide you through the remainder of this morning's ceremony.
Dr. Carr, thank you so much. Beautiful people. Look at you. This is the beginning for you. Are you totally excited? Yes? Yes. I'm excited for you. The White Coat Ceremony is the oldest and most well-known program of the Gold Foundation. The Arnold P. Gold Foundation established the White Coat Ceremony in 1993 at the Columbia University College of Surgeons and Physicians. This was a way to emphasize in medicine at the very start of the medical education. In 2014, recognizing the vital role that nurses play in the healthcare, the Gold Foundation partnered with the American Association of College of Nurses to adapt the ceremony for nursing. While it takes different forms, this rite of passage ceremony emphasizes the importance of humanistic patient care defined as compassion, collaborative, and scientifically excellent health care. Early in the training of your profession and identity formation. At this time, I would like to welcome our guest speaker to the podium, Dr. Mary Cutchins, Kent State University professor.
Hi everybody. My name is Mary Cutchin and I am a professor here at Kent State University. I'm very integrally involved in the accelerated program too. It's absolutely an honor to be here. This is such a pivotal time as you're going to begin your first clinical. You guys have sat through a lot of classes, you're college students, you've done a lot of that. Clinical is a very different experience. So we're so excited to begin this journey and have you put that white coat on and start the clinicals. When you think about nursing, the thing that I like to talk about is trust. We are considered the most trusted profession. We have been voted the most trusted profession for the past 23 years. That says something about nursing. So it's literally a testament to the positive influence we have as nurses. We have an influence on patients, communities, and the entire healthcare system. So you becoming a nurse, you have great responsibility. Dr. Koth already talked about the responsibility. Something you're going to hear over and over is responsibility and accountability in nursing, because we're dealing with patient lives. So the two things I just wanted to briefly talk to you about, because Professor James says I'm not allowed to talk very long because she has to teach class, is what is nursing and what is trust? Those are the two things I want to take with you into clinical. And nursing, it's kind of interesting. Nursing is built on pillars and trust is built on pillars, and they go together. So the 4 pillars of nursing are professionalism, leadership, scholarly practice, and stewardship. So professionalism, you're dealing with patients and families at their most vulnerable, stressful time. They're not always going to act perfectly how we might want them to act. But what do we expect of you? We expect you to be professional in all situations. You're the voice of reason. You're the calmness. This is your job. This is kind of business as usual, a patient coding. It's not a crisis to you, it's business as usual. You're able to handle all of these things in a professional manner. That's part of being a nurse. Leadership. There are so many components to the healthcare profession, and they're all so important, but nursing is the leadership that holds it all together. We're with patients and families more than any other healthcare provider. We're there. We understand the whole patient. When we're talking about things, doctor certainly knows the illness. Pharmacist certainly knows the meds. We know the whole picture of the patient, and we put it all together. Studies actually show that RNs prevent 84% of medication errors. So if you think you're just kind of following a sheet, you're not. You're looking at, why is the patient getting that medication? Why are they getting it now? You're looking at those things very deeply, and you really are the corner advocate for that patient to make sure they get the care that they need. Scholarly practice. This is something as faculty we are constantly keeping up with. There is always a change in the best and right way to care for patients. You are going to become lifelong learners. What you learn in your first clinical, you may learn something just slightly different as you go through other clinicals. The way you treat a mom and baby could be different than how you treat a 72-year-old. Just looking at individualizing that and using your scholarly practice. You'll take classes in evidence-based practice if you haven't already, to literally keep you updated on what is best for our patients, because that's why they trust us. And then one of my favorite words is stewardship. Stewardship, it goes way beyond responsibility. We talk about responsibility, but stewardship, I love the definition of it. It is the cautious and responsible management of something entrusted to one's care. So you think of the depth of it. We're in charge of patient lives. They are entrusting their lives to us. So I love that word stewardship, that we're really overseeing the care of these patients. So that's nursing. I want you to be professional. I want you to use scholarly practice. I want you to be a bedside leader and advocate for your patients. And I want you to have stewardship over all of the responsibilities you have. One of my favorite speakers, she's a sociologist out of the University of Houston, Brene Brown. She's done a lot of work on empathy. She studies empathy, but she also studies trust, and they kind of go together. And she actually came up with a acronym called BRAVITY. That's how you do trust. Trust isn't just one simple thing. How do you build trust and develop trust over time? And she used the acronym BRAVING. First one is B, boundaries. Set clear boundaries with yourself, with patients, with families. You do it kindly. They know what to expect. You know what to expect. So set the boundaries for yourself and set them for others about what you expect and what you want. The next one is R, reliability. You need to be reliable. To be able to trust you, patients need to be able to rely on you. They need to know you're going to do what you say. That's as simple as answering call lights. That's as simple as going back into the room when you said you would go into the room. If they trust us, their whole patient care stay in a hospital is going to be totally different than if they're sitting in that room alone, just wondering what's going to happen. Can I really rely on this nurse or nursing student to take care of me? Next one is accountability. My braving is accountability. Hold yourself accountable. As you're doing this, I'm always looking at other majors and that type of thing. Hold yourself accountable. When you were studying for a test in your classes with your faculty, you're not just trying to pass the test. You're going to be using these skills and this knowledge on human beings. That's a great responsibility. So be accountable for yourself. Understand how important everything you're learning. I talk about scaffolding too, because everything you're learning in this class, I teach more senior level classes. This is the building block, and you're going to use everything you're learning this semester up until graduation and beyond graduation. Confidentiality, the vault of confidentiality. You're dealing with very private issues and private problems. They have to be able to trust that you will keep confidentiality for them. They don't want to hear themselves talked about in the hallway. They don't want to hear anything negative being said. Be very careful. There's HIPAA guidelines. It's not just good ethical practice, it's the law. We need to honor that. Next is integrity, choosing courage over comfort. You're going to go into clinicals, and there's going to be times that you're like, I just want to stand back against the wall, let everyone else do something. If an opportunity comes up, take that opportunity. Make sure you put yourself out there. In nursing, you don't fake it till you make it, but you ask questions, you get involved, you try to learn things, because you're going to continue to learn all of these skills that you're doing. You're not just trying to get through a clinical day that you're tired or something like that. You really are absorbing all this knowledge because you're going to be using it, because eventually, especially with accelerated students, sooner rather than later, you're on your own and you're going to need that knowledge. Non-judgmental. I don't know if any of you are Ted Lasso fans. Anyone seen that? I saw the episode where he talked about be curious, not judgmental. And that's so important. Being judgmental doesn't help anyone. And if you're looking at patients, a lot of times they're in the hospital and you could judge them. Why did they smoke 3 packs of cigarettes a day? Why did they not take care of themselves? Those type of things. But if you're judging them, you're not understanding them. So be curious. Don't be judgmental of your patients. Figure out why they're in the situation they're in, and then you'll be able to help them. And finally, generosity. Be grateful. Be grateful for your faculty. Be grateful for the nurses in the hospital that are giving their time to help teach you. Be grateful for patients and families that are letting you participate in their care. Be as generous with others as you want them to be with you. Generosity and gratefulness go a long way. So, if you think about it, nurses are so trusted, and the doctor does the surgery. He does this great surgery. It's the nurse that the patient is actually trusting. Think about that, because trust is built over time with everything we're doing with them. So the pillars of trust are so important in this profession. My wish for you is for you to go out and braving. I want you to set those boundaries, be reliable and accountable, and I want you to respect vault, and I want you to choose integrity, curiosity, and just be kind to patients and take good care of them. We at the College of Nursing are so proud of you. Just to be part of this process, we are thrilled for you, and we are so excited to start this journey with you. And Dean Mallard.
sincerely hope that Dr. Cutchin's words stuck to you. That they really stick. Really, really stick. 12-hour shifts are long-hour shifts. You're going to be exhausted. There's two things, actually, I want you to remember. To err is human. If you make a mistake, don't hide it. It's that trust. Maintain that trust. If you lie, that trust is compromised. To err is human. You will make mistakes. I have made many mistakes as a BSN prepared RN. Number two is that the next day, the second day, the third day, the fourth day of your 12-hour shift is a different day. We forget. We think, oh my gosh, we're going back for another day. This is a day that you have never seen before. This is a day that you've never participated in. So go and refresh yourself and remember that each patient that you're taking care of is an individual. Yes, Dr. Cutchin inspired me to say these things. It's not on script. Okay? But you have to remember, because sometimes we fall into that. We forget that each individual is a mother, a father, a child, an aunt, an uncle. You do forget. You will forget. You will forget. You become so mechanical. But just reflect back to today. You have not been in clinicals yet. This is what White Coat celebrates. You're now moving into the profession. You're now moving into the profession. You're going to be so exhausted you're going to forget. Reflect back to Dr. Cutchin's words. So, with that said, it's now time for you to don your white coat. I will ask you to stand for the cloaking, for the pledge, and for the blessing of hands. Okay. All right, now, if you would don your coat. All right, thank you. You look beautiful. You will now be honored by by Professor Ann James, who will give you the pledge at this time. Thank you.
I'm also going to have Sarah Bixler come up. She's a big part of this summer. Would you agree? The summer couldn't go forward without her, for sure. Okay, so we're going to read the pledge together. You ready? As a nurse dedicated to providing the highest quality care and service, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns, act in a compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best of my ability, and assure optimal outcomes for my patients, exercise sound professional judgment while abiding by legal and ethical requirements, accept the lifelong obligation to improve my professional knowledge and competence, promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily with the full realization of the responsibility with which I am entrusted by the public. Yay, congratulations. Dr. Kelly.
Thank you, Associate Lecturers James and Bixler. It is customary to have healthcare workers receive a blessing of the hands. Please hold your hands in front of you. We take this moment to honor, protect, and enlighten the care and comfort these hands will provide to the scared and the sick. These hands will deliver compassion and respect for the people and families in your care. You may never understand all the ways your hands can heal, but your patients will. Being a nurse is a privilege and a gift to humanity. Please be seated. Dean Mallard.
Okay, so now you will receive a pen. This pen is from the Gold Foundation. This pen will be a visual reminder of the pledge that you made today. Just remember, if you're having a challenging experience at clinical, or you find yourself questioning why this path, look at this pen and remember that you made a pledge to care for your patients, with compassion, to care for your patients with dignity, to care for your patients with respect, to care for your patients with empathy. I believe in you. Your professors believe in you. We know that you will go out and you will serve the greater Kent State University College of Nursing, our traditions. You will represent those that have gone before you. You will be our legacy. We look forward to celebrating all of your future accomplishments and all of the work that comes before you and after you, as you are prepared at the BSN level as registered nurses. Congratulations to these accomplishments. Continue on this path of greatness. You may stand, and we would like to take a group photo. Thank you again, and congratulations.